you have low back pain or sciatica, or you've had that in the past, here's a warning for you. After 38 years of practice, I've dealt with hundreds of these type of patients. Typically, they're over 60. Their bodies are slowly becoming disabled and they don't even know it. In fact, in the history, they tell me that they've done a great job to manage their symptoms quite well. They'd use their anti-inflammatory medications, maybe icing, massage, or maybe they found out how to do a specific stretch exercises that managed to where their symptoms only lasted for a few days or a week, and then it'd go away until the next time it came back. They did mention that they used to be able to do things like play basketball, run, volleyball. Now they can only walk or swim, or they just slowly become disabled, and they blame that on age. It's not age, because there's a lot of people their age and they're doing those activities. It has to do about treating the underlying cause of their problem. So the way the body works is that you have 24 of these spinal bones that wrap around the spinal cord for protection. In fact, it's like a suit of armor. The brain sends messages down through the spinal cord out to the nerves, so all your organs and muscles and glands of the body allows to function correctly. And then messages come back up. And through these chronic stressful events like the poor posture over years period of time or these injuries, it causes one or more of those spinal bones to become misaligned. When they become misaligned, they will lock up that area, interfere with those messages going out to those specific areas. So then when you put stress on a weak link over time, it starts breaking down. And now you're not able to do the activities you'd like to do. You're not able to play basketball or volleyball. Your body's not able to put up with those physical stresses like it was before, because it's actually degenerating and you don't even know it. So the patients have been very successful are the ones that are always going to do these three things. And most of these things they can do at home. Number one, they're going to do physical therapy. They're going to do some simple exercises, 4 of them every day. Things like abdominal curl-ups, lateral planks, glute bridges, and bird dog. These will do a great job at strengthening and stabilizing the spine. Number 2, you got to find a good chiropractor that you can get in on a regular basis and get some specific adjustments and restore the proper motion of where those joints don't move properly in the spine. And number 3, that chiropractor has to take an x-ray and they can show you the correct type of home traction that you can do to help restore the proper posture and curve in your spine by strengthening and stabilizing the spine, providing motion back in the spine, and aligning the whole spine globally and fixing that posture. Now those spinal bones are no longer irritating, but they're protecting the spine once again. Now the brain can communicate with those body parts, with the muscles and organs and glands, and messages come back up. In other words, the body is going to be able to handle more stress. Can go out and do those activities that you weren't able to do before. So if you have some of these specific challenges, make sure you comment down below and we'll have a discussion on how we can best point you in the right direction so you can get back your active lifestyle. We appreciate serving you. Keep spreading the word, and we'll look forward to seeing you in our next video.